He is amazing. I mean, every parent's gonna say their kid's amazing, but he really is. He's incredible.
Very compassionate too.
He's
he always
very compassionate,
is
yeah.
concerned about how you are feeling or if you're okay.
He did this little shudder, and when his sweet little voice was like, "Mommy," and then just his eyes rolled back in his head and he went limp as a noodle. I actually realized that he wasn't taking air in. I really had to keep on telling him, "Stay with me, Milo, stay with me, Milo, you know, take a breath, take a breath, take a breath," because that was what was keeping me from imagining the worst.
You know, his parents pulled him from the back of the car, blue, unresponsive, and looking very lifeless. And what a horrible experience for any parent to have to go through.
And so I ran in with him and he was still limp.
And that image of him just hanging limp in Plevin's arms I was afraid that was going to be the last image I had.
So we brought him straight back, laid him down, and I don't really remember much after that. I think that's when Dr. Cope took over.
And he came in very distressed and actively having a seizure.
The next thing I remember was looking up and seeing 40 people from the hospital just kind of all standing around.
And he took a breath and started screaming his head off, and I was like, thank you, thank you, thank you.
So when they brought him back, the team jumped into action and everyone immediately went into their roles, and it was like clockwork. And I'll tell you why it was like clockwork, because we drill this every month. And the reason we drill it every month is for these situations. And the only reason we can drill is from the incredible donations that we've received to support this program.
It was a large team effort to help Milo. And I'm glad to say that he did very well.
I sleep better knowing that we do these simulations and that everyone has their A game on.
You could tell the procedure was in place and everyone was following it.
The training is evident because it was well oiled. It was very much a team.
What is it?
A balloon!
A balloon!
There are no words to convey how miraculous it is that there are people who can save lives.
But the ribbon cutting ceremony marks the end of a long journey. We've worked so hard and come so far and put so much time and effort into this. To see it all come together is incredibly fulfilling. We're so excited to be coming into the new space. We've worked on this for over 6 years. So the old emergency department was approximately 13,000 square feet, and the new emergency department is 24,000 square feet. We are increasing our room numbers. We had 15 main treatment rooms in the old emergency department, and we've increased that to 22 in the new. And there were 3 fast track beds, and we have 6 in the new. We really redesigned the front end so that when a patient comes in, we minimize the time it takes from them to get from walking in to see a provider.
Sorry to hear you're not feeling well.
We have a new real-time locating system so that we have badges that we wear, and they make it so that any staff member can locate us in the department. And we also have these real-time locating system devices on key pieces of equipment. So if you go to look for a piece of equipment and it's not where you expect it to be, instead of looking in every room to try to find it, you can go to a computer screen and look at the map and locate where it is and immediately go get that piece of equipment. So again, it's all about working smarter, not harder.
Yeah, I need 2 signal plugins.
Our supply cabinets lets us track and restock supplies in a much faster, more efficient, easier manner.
We have a brand new patient assignment board, which can direct the patients from the ambulance bay to their room. And we also have a brand new decontamination area, which is one of the largest in the area, which can decontaminate up to 100 patients per hour.
We really pride ourselves on taking exceptional care of the patient and having high patient experience and satisfaction scores. And I think bringing that foundation over to this brand new space is really going to be amazing. I can't wait to see the patients' expressions when they come and experience this for the first time, because that's who it's for. It's for our community.
So the connection between innovation, technology, and compassionate care go hand in hand. It could not have happened without your support. And I want to thank you on behalf of the Board of Trustees, on behalf of our community and all our patients, for all that you've done for Sibley and all that you will do